Hello everyone, I am LAKSHMI from 4th year BSc Nursing. Today we are going to discuss about the topic Colase. So Colase is a drug which is also known by its generic name docetates sodium. It's a widely used stool softener that helps relieve constipation by increasing the water content in the stool. It is classified as an emollient laxative and it is commonly prescribed for the patient who should avoid straining during their bowel movements, such as those recovering from the surgery, postpartum mothers, or individuals with cardiac conditions. So, the definition. Colase is a laxative that works by increasing the amount of water absorbed in the stool and making it softer and easier to pass. So the brand names of Colase are Duclosoft, docetates sodium, Correctol soft softener, Sofrac and Diolase. So the dosage is starting dose is 50 to 100 mg once twice daily, and the oral route is oral capsules, syrups, drops, and rectal suppositories. The dose difference usually 15 to 100 mg. So the route is mainly through the oral and the frequency is once daily or twice daily, common 100 mg or once daily or 100 mg twice daily depending on no need. So the mechanism of action: soften stool by elevating the water and fat to mix with feces. Does not stimulate peristalsis, work within 17 to 74 hours. So the pharmacokinetics: absorption is well absorbed orally. So the distribution is highly protein bound, accumulates in the adipose tissue. Metabolisms can be slowly metabolized in the liver. Half-life is 5 to 7 days, and the excretion is mainly via feces, minimal renal excretion. So the indications are like constipation, prevention of constipation, adjuvant in bowel preparation, postoperative patient, postpartum mothers. So the contraindications are acute abdominal pain, fecal impaction, intestinal obstruction, hypersensitivity, severe diarrhea, and children under 2 years. The side effects of the drugs are nausea, bloating, headache, hot flushes, and mood swings. So, the nursing responsibility: we need to assess the bowel habits, abdominal sounds, encourage fluids, encourage high fiber diet, do not use prolonged periods without medical advice, monitor for the electrolyte imbalances if diarrhea occurs. And the conclusion is, Colase is a well-tolerated and effective stool softener that helps ease movements bowels by increasing water absorption in the stool. It is especially used for the patients who must avoid straining, such as postoperative, postpartum, and cardiac patients. Proper nursing care includes assessing bowel habits, encouraging adequate fluid and fiber intake, and monitoring for the diarrhea or an electrolyte imbalance when used appropriately and short duration. So Colase supports comfortable and safe elimination without causing the irritation or dependence. Thank you all.